காம்படிஷன் இதுல வந்து நீங்க வந்து அங்க நீங்க நேரா ஜாயின் பண்ணி நீங்க தமிழ் செக்ஷனை கேட்டுக்கணும். ஒரு தடவை நீங்க செக்ஷனுக்கு போனதுக்கு அப்புறம் எங்களுடைய chat பாக்ஸ்ல வந்துட்டு எஸ் ஐம் இன் நான் ஒழுங்கு எழுதிட்டேன் எனக்கு கேக்குதுன்ற விஷயத்த எங்க கிட்ட நீங்க தெளிவுபடுத்திட்டீங்கன்னா உங்களுக்கு தெளிவாக விஷயங்கள் கேக்குதுன்ற நாங்க பண்ணிக்குவோம் வந்துட்டு. ஓகேங்களா? சோ நல்லா இது பண்ணிக்கிங்க. இன்னைக்கு வந்து Q&A செக்ஷன் உங்க சம்பந்தப்பட்ட கேள்விகளை எங்க கிட்ட நீங்க கேட்கலாம். ஓகே, நன்றி, வணக்கம். Back.
Okay, Ms. Joe, Burmese language, Mr. Nixon, Tamil language. Okay, interpretation is activated. Okay, good morning, everyone. Kale Vanakkam Mangalapa. Okay, today is our Friday session. So normally we will, do a lot of training on products knowledge. Okay, so next week will be on Ganoderma. Okay, this week a lot of things. So Ganoderma was not able to prepare. So halfway going because it's a very huge and very interesting topic. So today we will do on Q&A session. Okay, so those who have a lot of doubts, okay, because our session and we have participants more than 100, can go up to 150. So definitely you'll have a lot of doubts to clear, to ask questions. So today is the day that you can ask the question. So I prefer y'all put the questions in the chat bot. So it'll be easy for us because every time when you want to mute or unmute and speak, then we have to wait. A lot of time is consumed. Okay, I have to wait until you all explain this in Burmese to Miss Jo, and then Miss Jo come back to me, and then it takes about 5 minutes. So it's a lot of time will be wasted there. Okay, so I put it in the chat box. That will be much faster. All right, if you can ask the question in English, well, that will be even much faster. So we don't have to keep interpreting. All right. So everybody know that my name is Dr. Firdaus, being a medical doctor for more than 30 years. So what we've been, let me mute everyone first. All right. All is muted. Only co-host can unmute. And for those who wants to unmute, you can just put up your hand and we will help you to mute. All right. Being a medical doctor for more than 30 years, now what we're doing here is we are teaching people how to obtain the birthright, our health in a very easy way. And DXN is there to support and make things much, much, much easier. You see, with all these modules and knowledge that we have now, especially when you have DXN along with you, there is no way you can be unhealthy. Okay, so it is being healthy, it's very easy. Okay, but what to do in this modern world? Now we are doing a lot of mistakes, knowing or unknowingly, and with lack of discipline. So this is where the mistakes is happening in a very, very large way. Those days we never had all this kind of junk food, was very, very less. And nowadays accessibility is there, affordability is there. So people can just keep eating for 24 hours. All right. So let's see what are the questions we have. Wow. Okay. And that is Mr. Sam. Okay.
So far, no questions, doctor.
No questions, huh? Okay. So while you all wants to come up with any questions, okay. You see, there is three things which I always ask people to do. Okay, nourish your body with good nutrition. That is where the DXN comes. Okay, give your body the best nutrition. Filling up, it is not what we are supposed to do. just filling up the stomach. Okay, just just putting in food. That is very, very bad concept. You see, a couple of weeks back, I was talking to one of my friend. He said, eating is just a purpose of filling up. That is where you are not giving value to your own self. Okay? Ala kadar mengisi perut saja. You see, just filling up is the only purpose. No, you cannot do that. Okay? When you eat something, you must
Doctor.
have a purpose. Yes.
Nixon's mic is muted for a long time.
Okay. Okay, those in the Tamil channel, y'all can hear him. Please, I know, say some. But okay.
Yes, sir.
All right. Marimalam is the
சார் நான் ரொம்ப நேரமா நான் குழப்பத்துல உட்கார்ந்திருக்கேன்.
Oh, okay. Why there is an echo? Okay, should be okay, I guess. Okay. So, those mics, please mute, please. Okay. All right. No, just give me a minute. Let me check. Yeah. Okay. All right. The interpreters are doing good on the other side. Okay. So this is the major condition. Okay, where there's only two reasons why we fall sick. One, the main cause, the main reason is due to toxin accumulation in our body. Like 50 years back, we had very, very less toxin. At this point of modern world, in the modern era, 2023, we have large amount of toxin. Everything is polluted. Okay, so especially the fast foods has a lot of coloring and preservatives, and everything is coming into your system. You are not aware about this. Okay, then the second is malnutrition. Malnutrition is the major pandemic in this whole world. And this is what is causing a lot of other medical issues, such as diabetes. Diabetes is one of the biggest, pandemic. What is COVID? COVID is nothing. Okay. Due to diabetic, even the whole world is shaken up. And due to our fast food intakes and all. That is why I always tell my members, my team and all the DXNers and the patients to avoid flour-based food. Okay, flour-based is something that is extremely bad for the health. Extremely. Okay, and a lot of people even ask, can I take a little? That is up to you. Okay, if you value your body, how much is the little? Okay, you determine. Okay, if you're taking like 2 to 3%, then it's fine. But some people's little is, I don't know, every week is even a little. So especially bread, noodles, instant noodles, and all this is very highly processed, and a lot of MSGs has been added, coloring has been added, preservatives, and a lot of other things has been added. But it is yummy. Okay, then come nutrition. Yes, gone. One of the main reason the nutrition is missing from the food is because this foods has been processed, and also they are very high grade polished products. Your grains, the rice, and many more, the millets and everything is been bleached. That means they refine it and they've already taken out all the good part of the food. And they will add back all the synthetic. This is the issue. And also genetically modified organisms, which is GMO. Another big, great impact on our food chain. Which is one example which I can give is fruits. Fruit is the big problem. Okay. Co-host, if there is any questions, just highlight to me. Let me get my writing pad. Okay, just you can read it out. Why they want to count this? Okay, you see, the blood vessels, they said, according to science, you can go around the earth. That long it is, our blood vessels. Okay, it's very long. Okay, so that is answer for that question. Okay, any more questions? Mm-hmm. 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 Okay. Okay. Right. Yeah. Sinusitis. Yeah, this is sinusitis issue. Okay. Okay. You see, sinus is something which is due to sinusitis is something due to infection. Okay, you have your sinus cavities, your sinus area in the nose. So all this is been inflamed. So this is why you get this sinus issue. Let me just show you how the sinus problem is there. This is due to malnutrition and also can be due to toxin accumulation and all these things. Okay, you see this is your face. Okay, your nose. Okay. Okay. Your sinus areas, this will be your sinus areas. Okay. These will be your sinus areas. Okay, all these will be your sinus areas. This green part. So what will happen is, this is all connected. So when you have infection, and what will happen, this is the areas, all will get blocked. Okay, then with the steroid recommended from the hospitals and clinics or by doctors, that will spoil your nostril. Okay, the process here, it all will get spoiled, will get damaged. Eventually, when you have mucus, okay, which has been here for very long, what will happen? You will have very bad odor, smell from this mucus. Okay, this is a very simple problem. When you have DXN with you, what is the best for you from DXN for this problem is spirulina. Okay, RG plus GL. And also you can just take When this 3 is good enough, then you can just add any coffee, all the other things. Okay. Here, what is the most powerful, how it works very well is spirulina. Spirulina alone can solve a lot of sinus issues. Okay. So if things are really bad, you can take the RG, make into liquid, and then drop. Okay. Into your nose. Okay. Nasal drop. You can do that. Okay. Very easy. You can do that. Okay, we have the leaders can teach them. Okay, this is the issue. So sinus is not a big problem. Okay, even how bad it is, it can be resolved by this. But medically, to resolve sinus acute, a lot of things they have to do. But when you correct your body, okay, the thing is very simple. A correct B, B correct C. Okay. So this is the body, we correct the condition, and then the disease, it goes around. Okay, we correct the body. Okay, we correct the body. So you can say this is DXN. Okay, okay, DXN correct the body condition. The body correct the disease. This is disease. Okay, the sickness. So it goes on like that. It is very effective. Okay, the body is so powerful that it can get rid of all your issues. Okay, all your conditions. So what you got to do is remove the toxin, and you have to nourish back the system. Just don't think eating is only the taste. No. Okay, taste is also one part of it, but the nutrition, what you are taking is the most important. But what to do nowadays, we have very, very poor content of nutrition in our food. That is why you need extra. So DXN's food, it is not even vitamin. Okay. Not even supplement. No, it is not. Okay, it is not. It is not supplements. It is not supplements. It's not vitamins. It is a different category, which is called superfood. This is called superfood. Okay, it is a therapeutical food to fit full impact of result. So it is also it is just a food. Why I'm saying this is because if you want to give spirulina, there is no age barriers, no age. You can give it to 1 day old baby. You can give 1 day old baby, or you can even give 1 hours old baby, just born 1 hour. You can add into the mother's milk, or you can just make like a small liquid and put it into the baby's mouth. Okay, even the RG can be given to the baby, even the GL can be given to the baby, and all the other things you can give to the baby because it is food. All right, that is, if it is a supplement, you cannot do that. If it is kind of vitamins, you cannot do that. Okay, so you want to talk about what is the dosage? There is no dosage. You decide the dosage, how much you want. Like now, you're eating some kind of food. Say it is noodle, spaghetti, macaroni, whatever. What is the dosage? How many grams? Now you cannot do that, right? Okay. Now you're going to have some roasted chicken. Now what is the dosage? No. So there is no dosage. So also you ask another question, when should I eat, before food or after food? It is nothing to do as vitamin, it is nothing to do as supplement. It is a food. So do you eat food? You eat food before food or after food? when you eat food, you eat food before food or you eat food after food? Which is which? You decide. Food you eat when there is a need. Okay? When there is a need. Okay, when you're hungry, then you eat food. So same here. All right? When do you drink coffee? We have coffee. So do you call coffee as vitamin or supplement? None of this. Coffee is a food, which is a pure, high-graded, quality, premier coffee. But that will give you good nutrition. And a lot of people ask this question, this coffee is good for what? So I ask you another question. The coffee that you are drinking currently from X brand, what is it good for? What is it good for? Why are you drinking the X brand coffee? You yourself are not sure why you're drinking because you like coffee. So you're drinking the coffee. But this coffee, the X brand coffee, it is a bad coffee. Bad coffee. Cause disease. Okay? It gives you a lot of other problems, you know. Okay? So this coffee, DXN coffee, is a premier coffee. Good one. It will fix your problem. Simple. Okay? So that's why we are not doing any treatment here. Don't ask question, you know, what this coffee can do, what that coffee can do. We have more than 20 types of coffee in DXN. So which one you like, you drink. Now I'm drinking Flora tea. This is Flora tea today. Okay, so I have a small brewer here. You know, you use that, then use the Flora tea. That's a tea. It's a nice tea. It's a good tea. And what is this tea good for? God knows. But it is good. It's tasty. You know, it gives me a good, it doesn't damage my health. That's the important part. So whatever y'all are eating out now, it is every single bite you're doing, it is damaging your health. It is really damaging your health. So you have to be very careful. All right. I saw a couple of questions, I guess. Shall we? Any question on English?
Doctor, a lot of things in Burmese, doctor. Once I'm so
Okay.
completes, maybe go one by one or in between, doctor.
Yeah. No. Let's see from. It's true.
Okay.
Mm-hmm. What is the question? Okay. Okay. You see, okay, the question is, you know, what is the current seasonal flu and, you know, what is the current season flu and before this season flu and whatever flu it is. Okay, I'll tell you something very simple. Okay. You see, don't get, you know, hijacked by all this information outside they give you. Okay. Now the science is towards making money. Okay, you got to understand this part. That somebody has to make money from someone. Simple. Okay. So now medical field is, sorry to say that, it is very highly into profit. They want to make money. Okay. So if you are healthy, okay, you see, when Okay, let's go into this. Any kind of sickness, okay? Okay, disease comes from bacteria or virus. Only these two, all right? Either it comes from bacteria or it comes from virus. Okay, bacteria or virus. Only these two. Nothing else will be there. Whether it's going to be mild or it's going to be hard. Both need what? Your immune system, your immunity. This is what it needs. But the question is, do you have a good immune system? The answer is no. It is so bad. It is so bad. So what happened? Any kind of flu, fever, cough. Your friend cough once, you get the cough. Your friend has flu, you get the flu. Every single thing is contagious. Okay? We had this, our COVID, flu, the virus. Now nobody talks about it because it's becoming a very good friend now. We are just getting used to it. So you're getting, the virus is part of our life. And now everything. Chickenpox was like that many, many years back. Even TB, tuberculosis was like that. And now nobody is worried about TB, tuberculosis. You can just walk around with TB. Those days you cannot do that. Okay? You have a loss. You see, even like, 2 years back, what happens when you have a COVID, an ambulance comes to your house, pick you up, you must go, you get isolated, they treat you. It was very scary. People are so scared. Nobody wants to go out. Now, even you have a COVID, in the hospital, they tell you you can go back and rest in your house. Anything get worse, you call us. We will come and help, or we will send you help, they said. So whatever it is, what you need is immunity. Okay, your body. This is your body. You need to have a good, healthy body to overcome the medical issues that you have. Okay? This is infection. Even a diabetic, poor body. Heart problem, poor body. Very simple. Okay? This is what happens. Right? So don't, confuse yourself, this, that, old virus, new cough, communicable disease. And no, ask question. Whatever it is, ask question on your health. Are you healthy or not healthy? If you're not healthy, go and make yourself healthy. We have more virus. We get a lot of virus, a lot of bacteria, more to come. The question is you. It's you. All about you. Okay, so don't. Okay, there's one more question that I've seen there. A woman who wanted to give birth to 4 children. The first one died at 45 days. The second child died at 8 months. The third child died at 7 months. Okay, the one more child, don't know what happened. Okay, you see what this shows is a miscarriage. The baby cannot continue. This is definitely the mother is very weak. So this is not a disease. The mother is so weak, so the mother need to have a proper nutritional food. So what you got to give here is whatever we have in DXN, ask the mother to consume. The most important, RG, GL, spirulina. Spirulina is the most important. Ask her to eat a lot of spirulina. Up to 40 to 50 or even 60 tablets during pregnancy. Okay, the hemoglobin. Now, every woman, you take their blood, you test, the hemoglobin is 8, 7, 8, whereby it's supposed to be 12. When for guys, supposed to be 13.5. But even they, the male, also have a very poor hemoglobin, just 10. The female has 8. Why? The vegetables that you eat has very poor iron content. Even those who eat vegetables is also the same. The reason? No nutrition. All these vegetables is genetically been modified. They look healthy. They put makeup for them before they come to the market. So they look very yummy, tasty, shiny, and consumers, they are caught with this because the biggest problem in this whole world is a lot of human beings already stopped thinking. They never think. Sometimes we have to remind them, excuse me, brother, you got to think. Then they'll say, oh, yes, yeah, that's right. See, they are not aware. They just go with the flow. So the biggest problem here is this. Everything comes without nutrition. So what kind of food is this mother is eating? The hemoglobin got to be very low. Nutrition just have to be very bad. Or either she's doing something that is really causing determination to the trimesters in the child. There is one first trimester, then second is 2 is third trimesters. This is really bad. Nutritional issue. Okay. So what is the next one? Mm-hmm. Okay. Okay. You see, it is very subjective, but it's very hard to say that, anybody who, yeah. He wants to become tall. You see, Nixon is laughing. He wants to become tall for height and what can he take? Okay. That is very, very rare cases. Due to malnutrition, they are short. Okay. Say suddenly you nourish the patient, then he grow 5, 6 inches or 10 inches extra. No, that will not happen. Maybe sometimes, we have done clinical studies. There will be half an inch or maybe 1 inch. That kind of difference you can see. If it's a severe malnutrition case, that you can have a little bit of that. Okay. And there is another scenario when you give them a lot of good, proper nutritional intake. Okay. If they do certain activities that can make them grow. Okay. And that is possible also, especially like swinging, hanging. They always hang themselves. But all this you have to do for a very long period of time. Then you can. But when you're going to do this, you got to do in the teenage time. Not when you give this kind of, supplements or nutritional food to a 70 years old man and make him tall. No, that will not happen. Right? Or maybe when he's very young, that can possible. Okay. So, but if you are short, mostly, you can't really correct that, most of the time you are like that. It is in your gene. Okay. So it is very, very, it depends and very subjective in this matter. Okay. Okay. There's one Tamil question.
Doctor, can I read, doctor?
Yes, please.
Tamil or English, doctor? Can I translate English and?
Yeah, you can tell me in English.
Okay. Doctor, by taking excess allopathy medicines, liver
Uh-huh.
has it is a kind of become big size, doctor. Which
Yeah.
kind of DXN food will help to address this disease, doctor?
Okay. You see, a lot of people wants to put the blame on the allopathy medication. Okay. But the allopathy medication will not really cause a lot of inflammation in the liver. Okay. Okay. I have a liver inflammation due to taking large amount of allopathy medicines. So this is the cause of the inflammation. So what are the DXN diet or food pattern which we are suggesting? Okay. You see, there is two things damage the liver. Okay. So the biggest issue here, the liver is damaged by, okay, this is medication. Okay, one is medication. Another one, the biggest culprit here is sugar, carbo, alcohol. Okay, your cookies, flour-based food. Okay, this percentage is very high, very, very high, this percentage. But nobody talks about it. Nobody's ever told you this. All the blame comes to the allopathy medication. But allopathy medicines does cause, but it's very small amount. I've seen a lot of people has got very good control on the food. They don't take all this, but they are taking allopathy medication for years. I've never seen a liver get damaged. No. The liver enzymes, the liver test every time we do, that is good. Why? They take care of this area. There is another group of people, no medication at all, especially the kids nowadays. They have non-alcoholic fatty liver syndrome. This is the biggest problem now we are having. Great inflammation in us little kids, fatty liver and also inflammatory liver. Okay, so if you cut this, okay, if you cut this, say you cut this, you reduce all this will improve. Okay, and what will happen? This medication, there is no need for your medicines also. You also can live a medicine-free life if you cut this. All right? So you don't have to continue taking this. So here you can you have to stop all the flour. Okay, the 4 things always I used to ask you all to stop. First one is flour-based food. Okay. The second one is sugar. All type, natural and non-natural, synthetic, whatever. Third is milk. A lot of people have a habit of drinking milk. You have to stop this as well. The fourth is fruits. And people are eating way too much of fruits. Why? Somebody along their life have claimed or said the fruit is good. Fruit was good when 40 years back. But now don't put money and buy fruits no longer. Okay? The only one reason why you eat fruit is because it is sweet. If anybody were to buy fruits from your house which is not sweet, you're not going to eat. Okay? Right? Okay. So the only reason you eat fruit is because it is sweet. If it is not sweet, nobody is going to finish it. If it is sour, no. Okay? Milk, is a foreign protein and it is not digestible, can lead you to type 1 diabetes, which is non-reversible. Sugar is not our food. We are using way too much of sugar. This is another biggest problem. This is also a poison. So use very, very small amount is fine. Okay. But now, technically, if you were to see, sugar is 75 teaspoon we are eating now. 75 teaspoons of sugar has been consumed by every individual from morning to night. Okay? With all the single meals. And that is the biggest problem. If you ask them to stop the flour-based food, they become lost. They say, what else should I eat? Because the morning breakfast starts with flour. Okay? When you see people are very obese and they're not eating much food and they eat bread. Bread is the big time culprit. And they are lost. They're very confused. They said, I never eat anything, yet I'm fat. Why? Such a high glycemic index, no fat in bread, and very high sugar content. And that really gives you huge problem. Okay, so that's on the food area. Okay, let's see what other questions we have.
Doctor,
Okay.
one more question, Doctor. For a broken bone in hand, what DXN food can help, Doctor? Broken bone in the hand.
Okay, the question is for strengthen the bone. Okay, whether it's broken or non-broken doesn't matter. It's to strengthen. I'll say it in that way. To strengthen the bone, what can we give? You see, spirulina is the best. Okay, so give a lot of spirulina, but you can add a lot of other things if you want to. For those who have pearl powder, you can give pearl powder. So those who have the Nutri-Z, you also can give Nutri-Z. You want to put in Ganoderma, also can. All the other things also work along. But the most important here is spirulina. Okay, say they don't have money, they only have a choice of buying one thing, spirulina. Then what you must do, cut all the food which cause disease. Flour, milk, sugar, fruits. Reduce or stop or whatever. They have to do this. Okay? Then the calcium will start to take place where it got to go in. And another important thing, your body has to move. Then only the demand is being created. If there is no demand, the calcium will just bypass and be out of the body. Okay? You got to move. All right.
Ma'am, show a few things. Questions are in Burmese.
Mm-hmm. Beans. Beans is it? What is peas? Peas. what? Beans, I think. Beans. This beans is he referring to? These beans? Is he referring to these beans? Oh, okay. All right. It's actually a soya bean, it is, yeah, sprouted sprouted soya beans, yeah. Okay. You see, yeah, when you have, the question is, especially when you take a certain types of food, especially beans or either beans categories, he have this stomach upset and pains and cramps and all. Okay, you see, when you have a very poor stomach, what are you eating is very important. So when you are in the process of treating the stomach, always take things which is easy digestible. Next, second, you have to chew the food well and try to add some fat into that food that you are eating, which is coconut and all these kind of things. You can even add some DXN black cumin or also the coconut oil, the VCO. So this will help the enzymes to take place. So all this kind of problem comes due to poor enzyme intake, because they are eating very bad things, which is sometimes they take the bitter leaves, the tobaccos, they chew them, all this has destroyed or damaged the microbiome in the stomach. Okay, so the body is trying to communicate with you. Okay, so you have to understand and give what the body needs. So don't say that, why I cannot eat this, why I cannot eat that. So most of the food that you are eating is already damaged extensively, that you are not supposed to eat, especially those who are drinking a lot of alcohol. Okay, so this kind of food that you should avoid. So yes, integrate with healthy and then give some time for that body to recover. Okay, even you can add spirulina into that, the beans, then give a try. If it doesn't work, stop for a while. Okay, that's how you go about this. Okay. Okay.
Nancho, any more questions in Burmese?
This
Yeah,
is a lot.
yes.
Okay, you see, if you ask me, okay, they're very simple, why it happens, because not enough nutrition, this one. Second, they are not eating. Mr. Nixon, you got a question? why does piles happen? That is the question. Okay. One main reason, too much of chili could be one of the reasons, eating too much of chili, or there is no, the best reason here is they are not consuming
சார்
enough.
கேக்குது
Uh,
இல்ல பாத்துக்கிறேன் சார், நீங்க பேசுங்க.
you are the main channel. Suddenly I got shocked. Or கேக்குது. Oh, okay. You see, when you don't take enough bacteria, good bacteria, and this is what happened. Lack of fiber, lack of probiotics, and it'll cause a lot of damage to the small intestine and the large intestine. So then all these things bundles up, and then you put pressure, and then you pulls out the arteries, nerves, and all the muscles, and all. And this is what causes piles. So if you want to treat the piles, you have to go with soft-based diet for a period of time, stop all the meat for temporary, and start to feed a lot of good bacteria. Bacteria need fiber. So fiber comes from vegetables and a lot of other things. But in DXN, it's very simple. Just take the micro-veggie. And then we have a lot of enzyme-based food. So use a lot of enzyme, moringy, morinzyme, codipine, all this. Even our coffee, Lindsay 3-in-1, has enzyme. Okay, fermented coffee has fiber. So we so many of our coffees are very, very good for this kind of problem. Simple. Okay, eating too much of bread, flour, sugar, milk, alcohol, all this will cause piles. Okay, it's also a dietary issue. Okay. 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 This is a hard problem, is it? Yeah. Newman, we go to the next question. We'll come to the question later. Instead of putting it in freezer.
Hello, good morning, sir. Good morning, doctor, sir. Good morning, all the leaders.
Yeah, good morning.
சார் இப்போ லிவர் சம்பந்தமா சொன்னார் இல்லையா, டாக்டர் சொன்னார் இல்லைங்களா, அதுல எனக்கு என்ன கேள்வி அப்படின்னு பாத்தீங்கன்னா, நம்ம டிஎக்ஸ்என் ஃபுட்டு என்ன சாப்பிடலாம், லிவர் எதனால பாதிக்கப்பட்டது அப்படிங்கறத பத்தி எக்ஸ்பிளைன் பண்ணாங்க. அதுக்கு நம்ம என்ன மாதிரியான உணவு சாப்பிடலாம் அப்படிங்கறத பத்தி சொன்னாங்கன்னா பரவாயில்லைங்க சார். டிஎக்ஸ்என் ஃபுட்டு என்ன சாப்பிடலாம். அப்புறம் ரெண்டாவது கேள்வி என்ன கேட்டிருக்கேன் அப்படின்னா, ஒருத்தர் அதிக அளவுல ஜிம்முக்கு போயிருக்காங்க. அதுல முட்டி ஜவ்வு கிழிஞ்சிருக்குங்க சார், வெர்டிகலா கிழிஞ்சிருக்கு. அவங்களுக்கு என்ன டிஎக்ஸ்என் ஃபுட் கொடுக்கலாங்க சார்?
Okay. You see, there is another question for liver issues. Okay, what can we take from DXN? That is one. Another one is went to the gym. He has a ligament torn. What can they give? Okay.
கால் வெளியில அடிபடலைங்க சார். உள்ளுக்குள்ளார ஜவ்வு மட்டும் வெர்டிகலா கிழிஞ்சிருக்கு.
Okay. You see.
ஆமா, எம்ஆர்ஐ ஸ்கேன் எடுத்து பார்த்தப்ப தெரிஞ்சிருக்கு. உள்ள கிழிஞ்சிருக்கு அப்படின்ட்டு. நீ பெயின் வந்து அதிகமா இருக்கு.
Okay. நான் சொல்றது நல்லா
சரிங்க சார்.
Okay. Yeah. Listen to this carefully. Everyone. The first question is internal injury, ligament torn. Second is the liver issue. You see, everyone now having this knee problem, ligament problem, tendon problem, muscle problem. The reason is this human who doing all this work, they are very, very weak. Very weak. Why? Why are they weak? If you ask them what they did, they have not done that much of this. The reason why they are weak, okay, they are taking acidic high diet, sugar high, okay, all this very high. Anybody who goes to gym, they always drink milk. Okay, you see, I'm a gym person. Okay, 8 o'clock to 11 o'clock, you cannot get me on the phone. I'll be in the gym. Milk. And they also eat a lot of bread. Okay. Every single food they take is acidic food, and this causes this much of problem. You see, I do bench press. Okay, I do squat. Okay, my squat weight is 150 kg. My squat. Okay, and those days I even used to do about 210 kg. Okay, I've never torn my ligament, never. Okay, and my legs, press, I do, even now I do 500 kg. I've never torn my ligament or tendon, none. The reason, I take care of recovery. That is why my intake of spirulina, okay, my spirulina, okay, my intake is 80 to 100 tablet. I take this much. The reason is because of this. Heavy. I'm doing very heavy workout. This is crazy. Okay? So, whenever you do sports, you need to take care of recovery. You need to take care of recovery. Prone of damage. Sports is damaging. It will damage your muscle. You need to. So when you are not eating correct, you are eating very inflammatory food. And this is what caused this. Very acidic diet. All kind of funny coffees, lot of sugar, milk. And even if this person is a vegetarian, it's big more challenge. The protein intake will be very insufficient, and there is no fat. The biggest mistake here in everybody's diet now is there is no fat. And in fact, we are doing a lot of training for people to eat fat now. All right? So this is a big problem. So in order to repair the kind of ligament, there's two things you must do. Remember, two things you must do. So one, your food, you must change. Food must change. This is lifestyle. You must do your lifestyle changes. So you must stop all your bread, you must stop all your sugar, you must stop all your milk intake, then you must add fat into your diet. This is fundamental, must do. Then you can see beautiful results. Second, DXN. Okay. Yes. What can you take from DXN? Every single thing it is good from DXN. Okay, every single thing. So the first one, what you will do, the best is spirulina. VCO, Morinzi. Why? Enzyme. VCO is fat. Spirulina has everything there, superfood. Quantity, let them decide. I suggest start from 20 per day. Okay. If you want to take 2, nothing you can get. All right. VCO, but 40 ml per day. Morinzi, 40 ml daily. Then you can add everything you want. Coffee. Yes. Coffee. All right. Ganoderma, yes, it's also superb. You can add RG and also can add GL. Okay, this is for the liver damage, the knee damage. So, okay, now liver. Okay, liver damage is caused by food. So, the correction, you cannot run away. You cannot run. There's no easy way out. Okay, you have to correct your lifestyle. Then DXN comes in. What is good from DXN for liver? Black coffee. New. No sugar. Spirulina. Morinzi. VCO. RG, GL, every single thing is good for the liver. Okay? So you must see what caused the liver problem. This one. Flour-based, pizza, sugar, cookies. Oh, no, I will eat everything from DXN. Okay, now I give you another scenario. They take DXN. They take everything. You know, spirulina, blah, 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 I know, everything they buy in it. Lifestyle, no changes. Morning breakfast, bread. Then lunch, noodles, chapati, parota, all other stuff. Tea time, cake, okay, and then cookies, okay, cookies. So this is another problem, okay, cookies, all this. Night, and here also rice. Night rice. This cannot be helped. You cannot be helped. Okay, why? Damage done, recovery done. Damage done, recovery done. Damage done, recovery done. When you're going to resolve the problem? Okay, you build the house, you damage it, you rebuild it, damage it, you build again, you damage it, and build it, damage. Okay. In Tamil, there's one proverb, I don't know how to tell in English. Okay, you pinch the baby, and then at the same time, you rock the baby as well. So you do the damage, you're trying to fix it. You do the damage, you must stop the damage. Remember that. Stop the damage. And this is where the discipline comes in. Okay. And in medically, to reverse a fatty liver issues, it takes very long. But for me, 2 weeks is good enough. I have hundreds of fatty liver has been reversed in 2 weeks' time. Chronic 2 weeks' time is good enough. What I do? Change everything on the food. If they're serious. Not serious, you better don't waste my time. Food. You must change. Then the DXN will rebuild. The day you cut your food, the day the body will start to recover. Simple. Okay? But what people want? Easy way out. Food, I will not touch. No compromisation on food. Don't touch my food. Okay? But tell me what I need to spend money on. I have the money. I can buy. I can eat. No, that will not work. Okay? That no, because they're treating the body like a rubbish, garbage dump, They're treating the bodies like a garbage dump. So they want to dump everything. They expect the body to do all the good works for them. No, what you eat, what you are. Simple. Okay? I hope this really clarifies them, Okay. Let's go to the next question. Yeah, let's do it fast. Yeah. I saw the photo. What is it about? Mm-hmm. 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 Okay. All right. The question is, this gentleman is doing some, powder coating work, and then once, these things get into the skin and all, it get worse. This is very simple. It's very clear cut, direct. Okay. This is toxin accumulation issue. So what you can do for them is give a lot of spirulina, RGGL, give a lot of RGGL. It's good. You can increase the dosage higher, like 12 pesos will be good. Depends on the affordability, and Morinji and black coffee and all these things. Okay. So, because nowadays the people who do this, the spraying job and all, they think they are Superman. So they don't use any protection, no mask, no suit, no glove. I've seen so many people spray. They say, no, all this is so trouble for me. I'm very strong. You're not a Superman, So you need to have the proper attire to reduce the impact of all these toxins. Okay. Now to fix this problem is not that easy, because whatever toxins goes into the system is until to the bone marrow. It takes don't know how many years to clear. Okay, but you can start with RGGL, spirulina, okay, Morinji, black coffees, that will help. Okay, next question. Mm-hmm. Mm-hmm. Okay. Mm. Mm. Yeah, okay. Let me, I know what is the problem. You see, okay, the question is cutting short, a lot of digestive issues before COVID, after COVID, as usual. After COVID, everything get bad. So all the mistakes, blame the COVID. Okay, that is what people will do. Never ever blame the COVID. You should be very grateful to the COVID. COVID has teach you a lesson. Okay, I think that's why all these things happen, because people do not know their standing. Where do they stand? Everybody put the blame on the COVID. After COVID, this thing happened. After injection, this happened. Why don't you ask question that how healthy you are? Because your health is so bad. Which part? Your stomach, your digestion, your small intestine, your large intestine, then your stomach. These are the 3 areas, 3 departments, 3 organs is responsible for your immune system. Okay? Why they are bad? Because your eating habits are very bad. So what you got to do now? Change your lifestyle, as I said. 4 nonsense that you cannot eat: flour-based, sugar, milk, fruits. Cut all this down. At the DXN, you recover. You will boom, come back. Simple. Okay. Or what? Another question will come. What should I take from DXN? Everything what you can buy, you buy. DXN is a food mall. The first you have to start with spirulina, then go with enzymes, then go with the coffee and all these things. Okay. So you got to understand, it's very simple. Very, very simple. What you eat is what you are. If you're not going to change what you eat, you can't see much results. It's very important. Okay. Everybody wants an easy way out. You're not going to compromise on what I eat. Don't ask for much of good results. You may just like a weather. Suddenly something will happen, then you may recover, then may something happen, and this is how it goes. Okay, so this child has a very dietary issues. Enzymes is not there. Glasses, ice packs. Now everybody, most of them are using glasses. The small little kids, you see the glasses are very thick. 150, 200, 300 a power. Why? No nutrition. The child doesn't eat, vegetables. Even the child eats vegetables. The vegetables doesn't come with nutrition. You see? So the spirulina is very, very important. So I have reversed a lot of, eye issue problems, power. How? Just by eating spirulina. So this is what you got to do. Very simple. All right. Change your lifestyle, add DXN into it. Everything will start to transform. Okay. Next question. Miss Cho, next question, please. Yeah. No. Mm-hmm. Mm. Okay. All right. Very simple. The question is, I had kidney stones before 9 years back. Now it's got it back because you never stop. You see, 9 years back, you put stone into your stomach, your food diet. So you get stone. After that, you never stop putting stones. Now more stones has come. Simple. That's what I'm telling. Stop damaging the body. If you are not going to stop putting stones, so you're going to keep having more stones. Okay, either you stop putting stones or you put stones and then you can build a house with the stones. All right. So be serious. So the food that you're eating is very highly toxic. Oxalates. Oxalates is what cause stones. Okay, so all the processed food and this and that and all what I'm telling you as contains a very high oxalate. So definitely you can get rid of it with DXN, but provided you're putting that much of effort and not damaging the system, then the system can recover. Even now you go and do surgery, you come back, you're going to have stones again. So stop putting the stones. So stones comes from where? All the processed food. So change your habit. Then or definitely the leaders will tell you. Now all the leaders know what products to give. Morinji, spirulina, RGGL, Richelieu powder, codipine, vinaigrette, and all these things will help you. Yes, but you are not going to stop damaging. First stop your damaging. Then definitely you recover. Okay, next question. Next question. Mhm. Okay. Question is, gallbladder has been removed. What will be the complication after removing the gallbladder? Okay, you will have a little of digestive issues, but it's not going to be a major, complications. If it's going to cause major complications, obviously we doctors will not remove your gallbladder. Okay, so the important thing again and again and again, I'm coming back. Stop damaging the system. You already don't have a gallbladder and you don't change your lifestyle, you're going to have the same problem, digestive issues. Gallbladder's purpose is to absorb fat and break fat. Now you're going to have issues on fat issues, but that is solvable. You can solve this with normal dietary. So stop damaging the system. You already consider a little weaker than the other human beings, right? Like myself, I have a gallbladder, you don't have a gallbladder. You see, so these are the difference. So you should put more attention and taking care. So use all the DXN products, take care of your life, sleep well, move well. So don't eat all the inflammatory food. Then your body can perform much better. Don't worry about the gallbladder because you're already not there. If you ask me a question with the gallbladder, then I can advise you further. You already don't have one gallbladder now. So it's no point. So what you can do next, that's the most important. So go back to the track and take care of it and keep your mind clear. And don't keep saying that you don't have a gallbladder. What can I do? What can I do? Nothing you can do. Okay. But it's not a big issue. Without a gallbladder, so many millions of people are surviving without a gallbladder. Okay. It's not a problem. So what you got to do is fix your diet and use the DXN products. You will be good. All right. Okay. Next question. Mm-hmm. Mm-hmm. Okay. You see, this person is eating too much. The question is, they have a fatty heart, big heart of fat surrounded the heart, doesn't matter. 34 years old, this person is eating way too much. Ask him to stop eating, eat the right food, and whatever the medically they do, you can follow. But if you're not going to fix their diet, you can't go far. You definitely can't go far. Okay. You see, our body is extremely powerful beyond measurement. Okay. I tell you all one story. You see, 2 months back, one gentleman came to me, my old patient. So for a certain period of time, he never listened. He forgot to upkeep his nutrition in DXN, and also his lifestyle was not good as before. He never take care. So he started to eat everything, and then suddenly one day he got a mild heart attack. He went. The doctor said, a lot of things. Then he was so worried. He came immediately and got consulted with me. So I told him this is reversible. But in the hospital, they said it is not reversible. Okay, you must go on medication. Then this guy know me, and then he trusts me, this confidence. He start doing every single thing I ask him to do. Okay, he followed 101%. Then after 60 days, he went back to the hospital. He asked the doctor, "Doctor, I want to do another ECG." The doctor told him, "You do ECG how many times or so, it's not going to do any changes. It's not going to be different." Then he called me and he said, "Doctor, this is what he said." I said, "Don't ask them, just ask them to do. And then you get the ECG, send it to me. I will show you where is the differences." So when the ECG is done, another second doctor got a shock out of his life. He said, speechless, because total contradicting ECG. First ECG is a cardiac arrest ECG. Second ECG is totally good ECG. The patient so happy. Okay. The person who cannot walk now walking 2 hours non-stop. And before, when he got an heart attack, he was obese. And it's not like 6 months, 7 months, 3 months, only 60 days, 2 months. You see, what you eat is what you are. Remember that. So that's why even a single bite you do, you have to pay attention what you eat. Life is so precious, so expensive, but we are the big culprit who damage it. So do your lifestyle change. Do all you got to do, okay? And there's so many of these Myanmar group people know what I asked them to do. Walk, food, sleep. And DXN products, RGGL, spirulina, all these things you can do. You don't damage your system. That's the most important thing which I ask everyone to do. You can see in 60 days or 90 days, the doctor will get a shock if you really do it, okay? Simple. All right. Thank you. The next one, we'll take the last question. If there's many questions. Yeah. Oh, yes. Okay. Okay. Mm-hmm. Mm-hmm. I don't know why no sperm. The question is, he takes the poila, the beetle. All right. And, Nixon knows what is poila. Yeah. You see, and then why he doesn't have the sperm now? I don't know why does he never have the sperm now. Now what he can do, stop the beetle, start to walk, use DXN a lot. Pray to the God that everything will refix back. We cannot say, because human system is so powerful. Ask him to believe in the creator and do it. But he has to do it really seriously. Then it is possible. Why not? All right. Yeah. Next question. Next question. Yes, Ken. Hypertension comes due to high sugar, not because of fat. So those who have hypertension, please consume good amount of fat, which is coconut from DXN VCOs. All that is very, very safe to eat. Okay. Yeah. The next question. Yeah. Okay. We're going to summarize. Yeah. Summarize. You see, you got to understand one thing. First, stop damaging your body. Your body is so powerful, yet, it is helping you. Back to back is helping. Okay, I live on fat. I live on fat. I take about, now my intake of egg is increasing. Okay, today itself I consumed more than 20. I lost count. My steps is 28,000 steps today. 28,000 steps, not 10,000 steps. Okay, and I start to walk 5 o'clock in the morning. All right, I have some targets for another 1 week. Okay, so a lot of transformation. I have, not only I do, I have a lot of other people also do along with me as one family. Mr. Sam, Mr. Nixon, Madam Panimalam, and Tida, even Tida, you all know Tida. Today we walked in Cyber Valley with Tida, the husband, downline, and we walked together. It is a joy. A lot of things you can talk. So value your body. Your body is so expensive. Why do you want to damage your system? This is what you got to do. This is my humble request from everyone. Okay? So after you damage, it is very difficult to reverse back. So when it is in a good condition, take care of it. Then you have DXN here to support you. Okay? DXN food is the most superfood. Awesome. You have a lot of good things to consume. You have tea, you have coffee, spirulina, so many things. Integrate everything. Okay? So definitely you got no choice. You have to live healthy if you follow the modules. All right? Yeah. Mankind is walking machine. Yes, man is a walking machine. You're born to walk. Okay, walk. 10, 20 kilometers, 28,000 steps is almost about close to 30 kilometers. Huh? Yeah. Don't worry about how many kilometers and all. Who cares about it? Just keep walking. Okay. Okay, so shall we finish this session? Okay. So we'll come to the end of the part. It's getting too late. People will get tired. Oh, still 146 people are listening. Yeah, that's good. Okay. Thank you to my co-host. Okay, Mr. Sam, the interpreter, Mr. Nixon, Madam Parimalam, Miss Cho, and all the awesome participants here. Today's session, the Q&A session takes a lot of time, but we just want to answer all the questions, but I think we did our best. Okay, so in case there is any questions or whatever we have missed off, please forward to your leaders. The leaders can get back to me, and sure we will able to clarify this or help you on getting more info on this. Okay, so let's end this session. Thank you so much, and bye-bye. Don't forget, walk as much as you can. Don't forget to eat well, right food, and don't damage your health. Okay, bye-bye everyone.